Growth and development in pediatrics encompass various stages. Infant developmental milestones include smiling, cooing, and grasping objects. Symptoms of developmental delays in infants might include not responding to sounds or not making eye contact. Toddler developmental milestones involve walking, speaking simple sentences, and playing with blocks. Signs of delays in toddlers can be difficulty walking or limited vocabulary. Preschool developmental milestones include drawing, social interaction, and basic problem solving. Symptoms of delays in preschoolers might be trouble with motor skills or difficulty interacting with peers. School-age developmental milestones involve academic skills, forming friendships, and developing hobbies. Signs of delays in school-age children can include struggling with schoolwork or social isolation. Adolescent development includes identity formation, abstract thinking, and independence. Symptoms of developmental issues in adolescence might be extreme mood swings or difficulty in social settings. Theories of development, such as those by Erikson, Piaget, and Freud, provide frameworks for understanding growth. For example, Erikson's stages highlight the importance of trust in infancy and identity in adolescence. Growth charts and percentiles are essential tools for tracking physical development. Addressing failure to thrive is crucial, as it can indicate underlying health issues or nutritional deficiencies. Nutrition is tailored to each age group, ensuring proper growth and development. For instance, infants require breast milk or formula, while toddlers need a variety of finger foods. Preschoolers benefit from healthy snacks, and school-age children need balanced meals. Teenagers should focus on a diet rich in fruits, vegetables, and proteins to support their rapid growth and hormonal changes. Essential aspects of neonatology and newborn care include APGAR score assessment, which evaluates a newborn's appearance, pulse, grimace, activity, and respiration. For example, a low APGAR score may indicate the need for immediate medical intervention. Monitoring newborn reflexes, such as the Moro reflex, helps assess neurological function. Managing neonatal jaundice involves checking bilirubin levels and may require phototherapy. Symptoms of jaundice include yellowing of the skin and eyes. Addressing hypoglycemia is crucial, as low blood sugar can lead to seizures. Treating respiratory distress syndrome, RDS, often involves administering surfactant and providing respiratory support. Preventing neonatal sepsis includes administering antibiotics and monitoring for signs like fever or lethargy. Handling meconium aspiration requires suctioning the airways to prevent respiratory complications. Tetralogy of Fowler, often called TOF, is a congenital heart defect that affects normal blood flow through the heart. Symptoms include cyanosis, difficulty feeding, and poor weight gain. Ventricular septal defect, or VSD, is a hole in the wall separating the two lower chambers of the heart. Symptoms can include rapid breathing, frequent respiratory infections, and poor growth. Atrial septal defect, or ASD, is a hole in the wall between the two upper chambers of the heart. Symptoms may include fatigue, shortness of breath, and swelling of the legs, feet, or abdomen. Patent ductus arteriosus, also known as PDA, is a persistent opening between the aorta and the pulmonary artery. Symptoms include a heart murmur, rapid breathing, and poor feeding. Kawasaki disease is an illness that causes inflammation in blood vessels throughout the body. Symptoms include fever, rash, and swelling of the hands and feet. Rheumatic fever is an inflammatory disease that can develop as a complication of untreated or poorly treated strep throat. Symptoms include fever, painful joints, and a characteristic rash. And heart failure in children can result from various congenital or acquired heart conditions. Symptoms include fatigue, shortness of breath, and swelling in the legs, ankles, or feet. Gastrointestinal disorders in pediatric patients include pyloric stenosis, intussusception, Hirschsprung disease, appendicitis, GERD in infants, celiac disease, and inflammatory bowel disease. Pyloric stenosis often presents with projectile vomiting in infants. Intussusception can cause severe abdominal pain and current jelly stools. Hirschsprung disease leads to chronic constipation and abdominal distension. Appendicitis is marked by acute abdominal pain, often starting around the navel and moving to the lower right abdomen. GERD in infants may cause frequent spitting up and irritability. Celiac disease results in diarrhea, weight loss, and fatigue due to gluten intolerance. Inflammatory bowel disease, including Crohn's disease and ulcerative colitis, can cause chronic diarrhea, abdominal pain, and growth delays. Let's delve deeper into some common genitourinary disorders in children, along with their symptoms and examples. Urinary tract infections, or UTIs, are quite prevalent among children. Symptoms include a strong urge to urinate, a burning sensation during urination, and cloudy or strong-smelling urine. For example, a child might frequently complain of pain while urinating. Nephrotic syndrome involves the kidneys leaking large amounts of protein into the urine. Symptoms include swelling around the eyes, feet, and ankles, and foamy urine. A child with nephrotic syndrome might wake up with puffy eyes. Acute glomerulonephritis is characterized by inflammation of the tiny filters in the kidneys. Symptoms can include blood in the urine, swelling, and high blood pressure. For instance, a child might notice their urine turning a cola color. Vesicoureteral reflux is a disorder where urine flows backward from the bladder into the ureters or kidneys. Symptoms include recurrent UTIs and kidney infections. A child with this condition might experience frequent urinary tract infections. Enuresis, commonly known as bedwetting, is also something we encounter in children. It can be primary, where the child has never been dry at night, or secondary, where bedwetting starts after a period of dryness. For example, a child might wet the bed several times a week. Lastly, renal failure, which can be either acute or chronic, is a serious condition affecting children. Symptoms include decreased urine output, fatigue, and swelling. A child with acute renal failure might suddenly stop producing urine. Let's explore neurological disorders affecting pediatric patients. Seizures are common and can be febrile or related to epilepsy. Febrile seizures often occur in young children with high fevers, while epilepsy involves recurrent, unprovoked seizures. Meningitis is a serious infection that impacts the protective membranes covering the brain and spinal cord. Symptoms include severe headache, fever, and neck stiffness. Early diagnosis and treatment are crucial. Hydrocephalus involves an abnormal buildup of cerebrospinal fluid in the brain, leading to increased pressure. Symptoms can include an unusually large head, vomiting, and sleepiness. Treatment often involves surgical intervention. Cerebral palsy is a group of disorders that affect movement and muscle tone. Symptoms vary but may include stiff muscles, exaggerated reflexes, and difficulty with coordination. Early intervention and therapy can improve outcomes. Neural tube defects are birth defects of the brain, spine, or spinal cord. Examples include spina bifida and anencephaly. Symptoms depend on the severity and location of the defect. Prenatal vitamins with folic acid can help prevent these conditions. Reye syndrome is a rare but serious condition that causes swelling in the liver and brain. It often follows a viral infection and is associated with aspirin use in children. Symptoms include vomiting, confusion, and seizures. Guillain-Barré syndrome is a rapid-onset muscle weakness caused by the immune system damaging the peripheral nervous system. Symptoms include tingling, muscle weakness, and difficulty walking. Early treatment can improve recovery outcomes. Endocrine and metabolic disorders in children encompass a range of conditions, each with unique symptoms and treatment approaches. Type 1 diabetes mellitus is a chronic condition where the pancreas produces little or no insulin. Symptoms include increased thirst, frequent urination, and unexplained weight loss. Congenital hypothyroidism is present at birth and results in a deficiency of thyroid hormone. Symptoms can include jaundice, a puffy face, and a large tongue. Growth hormone deficiency can lead to shorter stature and other developmental issues. Children may experience delayed growth and a younger-looking face, and precocious puberty is when a child's body begins changing into that of an adult too soon. Symptoms include early development of breasts or testicular enlargement and rapid growth spurts. Hematology and oncology in pediatrics cover conditions like iron deficiency anemia, sickle cell disease, hemophilia, and leukemia. Iron deficiency anemia can cause fatigue, pale skin, and weakness. Sickle cell disease often leads to pain episodes, swelling in hands and feet, and frequent infections. Hemophilia is characterized by excessive bleeding and bruising. Leukemia symptoms include fever, bone pain, and frequent infections. These fields focus on diagnosing and treating blood disorders and cancers in children. Musculoskeletal disorders in children include conditions like developmental dysplasia of the hip, or DDH, where the hip joint is improperly formed. Symptoms of DDH include uneven leg lengths and limited range of motion. Clubfoot is a deformity where the foot is twisted out of shape, often requiring casting or surgery. Scoliosis, a curvature of the spine, can cause uneven shoulders and back pain. Osteogenesis imperfecta is a genetic disorder causing brittle bones, leading to frequent fractures. Juvenile idiopathic arthritis is an inflammatory condition affecting the joints, resulting in pain, swelling, and stiffness. Measles, also known as rubeola, presents with a high fever, cough, runny nose, and a characteristic red rash. Mumps causes painful swelling of the salivary glands, fever, and headache. Rubella, or German measles, features a mild fever and a rash that starts on the face and spreads. Varicella, or chicken pox, is marked by an itchy rash that turns into fluid-filled blisters. Pertussis, or whooping cough, leads to severe coughing fits. Scarlet fever presents with a red rash, sore throat, and high fever. Fifth disease causes a slapped cheek rash and mild illness. Hand, foot, and mouth disease results in sores in the mouth and a rash on the hands and feet. HIV in children can lead to recurrent infections and growth delays. Finally, torch infections, which include toxoplasmosis, other agents, rubella, cytomegalovirus, and herpes simplex, can cause serious complications in newborns. Psychosocial and behavioral issues in children encompass a wide range of conditions and challenges. These issues can manifest in various ways, affecting a child's emotional, social, and academic life. Attention Deficit Hyperactivity Disorder, often referred to as ADHD, is one of the most common behavioral disorders. Symptoms include inattention, hyperactivity, and impulsivity, which can impact a child's performance in school and their interactions with peers. Autism spectrum disorder encompasses a range of neurodevelopmental conditions that affect social interaction and communication. Children with autism may exhibit repetitive behaviors and have difficulty understanding social cues. Learning disabilities impact how children process information, making it difficult for them to succeed in traditional educational settings. Examples include dyslexia, which affects reading, and dyscalculia, which affects math skills. Anxiety and depression can significantly affect a child's daily life, leading to emotional and behavioral challenges. Symptoms of anxiety may include excessive worry, restlessness, and physical symptoms like headaches. Depression can manifest as persistent sadness, loss of interest in activities, and changes in sleep patterns. Child abuse and neglect are critical issues that can have long-lasting effects on a child's mental and emotional well-being. Signs of abuse may include unexplained injuries, fear of certain adults, and behavioral changes. Eating disorders, including anorexia and bulimia, are serious conditions that require professional intervention. Symptoms may include extreme weight loss, preoccupation with food, and distorted body image. And finally, separation anxiety is quite common in young children and can be distressing for both the child and their caregivers. Symptoms include excessive fear of being away from parents, nightmares, and physical complaints like stomach aches. Pediatric trauma care involves quick and efficient responses. Pediatric Advanced Life Support, or PALS, is crucial. Managing shock such as septic shock, which presents with fever and lethargy, hypovolemic shock, often due to severe dehydration, and anaphylactic shock, marked by difficulty breathing and swelling. Treating poisoning in children includes identifying symptoms like vomiting and confusion. Handling burns requires immediate cooling and pain management. Drowning incidents necessitate swift resuscitation efforts. Foreign body ingestion can cause choking or abdominal pain, requiring prompt removal. Pediatric vital signs by age. For example, a normal heart rate for a newborn is 120-160 beats per minute. Pain assessment tools such as FEL-ACC and Wong-Baker. FEL-ACC is used for infants and nonverbal children, while Wong-Baker is for older children. IV fluid calculations, both maintenance and bolus. For instance, maintenance fluids are calculated based on weight. Pediatric medication dosing, such as acetaminophen for fever, is weight-based. Vaccination schedule, including MMR and DTaP. Common lab values in pediatrics. For example, normal hemoglobin levels vary by age, with newborns having higher levels than older children. Care for special populations in pediatrics includes managing preterm infants who often face respiratory distress and feeding difficulties. Addressing chronic conditions in children, such as asthma and diabetes, requires ongoing monitoring and treatment. Supporting those with genetic disorders like Down syndrome involves early intervention and therapies to aid development. Facilitating transition care for adolescents with chronic illness ensures continuity of care as they move to adult services. Providing pediatric palliative care focuses on improving quality of life for children with life-limiting conditions, managing symptoms like pain and fatigue. Legal and ethical issues in pediatric care include consent and assent, emancipated minor laws, mandatory reporting laws, cultural considerations, and the family-centered care model. For example, obtaining consent involves explaining procedures in a way that both the child and parents understand. Emancipated minors can make medical decisions without parental consent. Mandatory reporting laws require healthcare professionals to report suspected child abuse. Cultural considerations ensure that care respects the family's beliefs and practices. The family-centered care model emphasizes collaboration between healthcare providers and families to support the child's well-being.